Pharmacokinetic brief update, half-life, and steady state. So what do we mean by half-life? Well, it's the time it takes for the concentration of the drug in the plasma or the total amount in the body to be changed by 50%. So if we're talking about elimination half-life, then that's the time taken for the drug concentration to fall by half when the drug is stopped. And for some molecules, this can be minutes, and for many monoclonal antibodies, this is measured in terms of weeks, so they can be quite variable. Half-life can apply not only to elimination half-life, but we can also talk about other pharmacokinetic processes. So for example, you can have absorption half-life, which is the time taken for half of the drug to be absorbed, or distribution half-life. And the unit of half-life is always time. So why is this important? Well, in clinical trials, with a single dose, the half-life gives you a sense of how much of the peak concentration is still around at a particular point in time when you're doing your adverse effect assessment. So it's important from that point of view. It also helps determine the dosing regimen for the multiple ascending dose as well as the phase 2 studies. It also helps determine the time needed for a washout of drugs when you're doing a crossover design. In clinical practice, half-life is very important because it determines how long drugs hang around for when you've stopped them for an adverse event. So for example, when a patient is on an ACE inhibitor and develops angioedema, how long do you have to hang around for waiting for the ACE inhibitor to wear off? It also determines how long you need to wait when making dosage changes, so the time taken to get to the new steady state. We'll talk about this concept shortly. It also helps determine the dosing regimen of medication. So if a drug has a short half-life, then in fact it has to be given more often. Otherwise, what you find is that the drug concentration tends to fluctuate quite a lot between dosage administrations. So in clinical practice, this means that when we give an intravenous dose of the drug, you can see here the concentration falling away. And so the half-life is the time taken for the drug's concentration to halve. On a logarithmic scale, what we find instead is that you get this straight line as a drug's concentration falls. But the idea of the half-life is still exactly the same. It's the time taken for the concentration to fall to a half. And this is brought to you by the good folks at icp.org.nz. So what determines the half-life of the drug? So it's a combination of clearance and volume of distribution. This is the exact equation. So half-life is equal to 0.693. If you can't remember it, just remember that it's proportionate to the volume of distribution on top and clearance at the bottom. So the larger the volume of distribution, the larger the half-life. The larger the clearance, then in fact, the lower or the shorter the half-life. And this is very closely tied to the idea of steady state, which we'll talk about shortly. Steady state is defined as the state when the rate of the drug coming in is the same as the rate of the drug going out. And at steady state, the average concentration is equal to the dosing rate of the drug over clearance. And this is an important concept when we're looking at, for example, giving slow intravenous infusions of the drug in places such as intensive care, or where we're giving a set dose of the medication on an oral basis, say every day, long term. So in that cases, the average steady state concentration is dependent on our dosing rate that we're giving divided by the clearance. But the time that it takes to get to steady state depends on half-life. So it's said to take about 5 half-lives, and technically speaking, it's the longest half-life of elimination, absorption, distribution, whichever is the longest half-life, and generally speaking, it's elimination, to get to steady state. So imagine here that we're giving an intravenous infusion. This might be someone in intensive care who, for example, is getting an infusion of something like insulin or adrenaline or an antibiotic. Then what happens is that after one half-life, then by definition, they get to 50% of their concentration they're going to achieve down here. Then after two half-lives, that ends up being 75% because now they get halfway between 50 and 100%. So that's 75%. And as we keep going, at three half-lives, you get to about 87.5. At four half-lives, 93.75. And so we say, look, by the time you get to five half-lives, then that's really close enough to get to steady state. So it takes five half-lives to get to steady state. Now, as you're sitting there enjoying your cup of coffee, remember that the half-life of caffeine is about 1.5 to 9 hours. So it's actually quite variable. So let's imagine that your half-life is 2 hours. And let's say that you have a cup of coffee every half-life, so every 2 hours. In actual fact, it takes 10 hours for you to get to steady state. That's quite a long time. And then if you actually stop, it then takes a further 10 hours for the drug concentration to wear off, so you can then fall off to sleep. So let's say then that you start drinking at 7 o'clock in the morning and you have a cup of coffee every 2 hours until you achieve the blissful state of steady state caffeination. And then if you decide to go to sleep, even at 11 o'clock at night, you still have 12.5% of your steady state concentration still in your system when you're trying to nod off to sleep. And all that information is brought to you by the beauty of half-life.